Welcome to the show. So let's dive in. What are we talking about tonight? We are talking about Liver Detox 101. I wanted to dive into this particularly because so many people cheat during the holidays. It's just the reality. I mean, I don't like to hear it when people cheat on their diets. I don't like it when people go and have, celebratory forks and knives and literally stab themselves to death with food, right? I mean, that's one of the things that happens when you celebrate with the wrong kind of food. So many people do it. It's just the reality. So what is it that you can do, or what is it that you should be concerned about when you're coming out of one of these, we'll just call them food binges. So Laura from Pennsylvania, Jennifer Lee chiming in. Hi, Jennifer. Northern Indiana, Matthew chiming in. So again, the liver plays a big role in cleaning out the garbage. It's one of the ways that we take out the trash, the internal trash, right? So when you're eating things that you shouldn't, or when you're getting exposed to things that are potentially dangerous toxins, particularly whether it's even not food, but air and water, there are a number of different chemicals that we're surrounded by. It. I think last count, the EPA said that 20,000 some odd new chemical exposures in the last 50 years as a result of progress, as a result of technology. So our bodies are being exposed more than they've ever been exposed to at any point in history and time. And then you couple that with food, right? With eating some of the wrong things, potentially eating many of the wrong things. And what's popular around the holiday? Alcohol. A lot of people get together with families, and alcohol, having a drink is a very common kind of pastime for a lot of folks. So we end up coming out of the holidays with generally too much sugar, too many carbohydrates, too many toxins in the food, and sometimes, depending on your family, toxic relationships in your family, depending on how much you suffer through during the holiday season with family members. Some of you have wonderful families. Some of you may have dysfunctional families, and some of you, probably most of you, have a kind of a combination. And then we add alcohol to that mix, and alcohol being a direct liver toxic agent. So again, thought I'd talk about some of these things tonight. So let's talk about some basic functions of the liver. Number one, a lot of people talk about liver detox, but don't really talk about the details of what a liver detox actually is. So when we think about the liver and how the liver takes care of us, I want to give you some kind of points and takeaways to think about. Number one, when I was taking biochemistry in graduate school, my instructor always said the liver is the giver. And he did that just to kind of help us remember. So I like to use that and credit him for that. But the liver is the giver. So in essence, the liver is a storehouse. It stores vitamins, it stores fats, it stores minerals, it stores nutrients, it stores triglycerides. There are a number of different things that the liver stores to help us with the nutritional needs of the body when we have times of famine or when we have a greater degree of need. So for example, the liver can produce glucose if you're fasting. The liver can actually go through a biochemical process where it can take and it can convert and put glucose into your bloodstream, even if you're not eating. So, it's giving you the nourishment that you need if the nourishment's not there. In many cases, we see people who may go on longer periods of time where they're not getting adequate nutrition, and the liver will dump vitamin B12 and it will dump stores of other nutrients, particularly B vitamins. The liver's rich in iron, stores a lot of iron. So it will dump these nutrients into the bloodstream for your tissues to get access to use, so that your body has the ability to keep going. So keep in mind, the liver, not only is it the detoxifying agent, meaning it takes out the trash, but go back and remember this: the liver's the giver. It stores a lot of very vital nutrients that are important for the function of your body. We've got Arlandis from Sydney, Australia, and Alejandra from Caracas, Venezuela. Wow. So again, like I said, all over the country, everybody's chiming in. So liver is the giver. And we have to keep that in mind, because if you are damaging your liver, you're actually damaging your ability to have adequate nutrition in the long run. In essence, you're damaging your liver's ability to store for a rainy day for you if you're damaging your liver. So keep that in mind. The liver helps to store nutrients to supply to you. Now, a couple of other functions of the liver that sometimes get overlooked. One is that the liver produces bile. Now, many of you, maybe you've had your gallbladder removed. There's something called cholecystitis, And a lot of doctors, look, when you have an inflamed gallbladder, they say, oh, your gallbladder's not important. Let's just take it out. Let's just do the surgery. And so they do what's called a cholecystectomy, which is a removal of your gallbladder. In my opinion, unless it's an acute emergency that's threatening to kill you, you shouldn't have your gallbladder removed. And that's because of its function. Look, the liver produces bile. Bile acids are important for a number of different reasons. And it stores those bile acids in the gallbladder, which is attached to the liver. Now, the gallbladder can dump bile acid into your small intestine through what's called the common bile duct. It's a duct that attaches your bile gland to your small intestine. And so when you're dumping bile into the small intestine, understand what bile does. Bile, number one, it binds to toxins in the GI tract. Look, we eat toxins every day. Even if your diet is organic and pristine and grown in the best soils, there's still going to be bacteria. There's still going to be other types of potential dangerous agents in your food. That's just part of life. You know, it's not, your food is not perfect in that sense. So when things are coming in, your body protects itself. Your liver helps protect your body in the GI tract through the production of bile salts, which bind known toxins. And so, for example, mold toxins, mycotoxins are bound through bile acids. It's one of the ways that we poop them out. We use bile as a toxin grabber to bind onto these things and get them out of our body. But bile is also important for the absorption of fat-soluble vitamins. It's vitamin A, vitamin D, vitamin E, vitamin K, but also omega-3 fatty acids, which are lacking in most people's diets, and many, many people are deficient in omega-3 fatty acids. Remember, these fats help to regulate inflammation. Vitamin A helps to regulate your skin turnover, regulate your gut turnover. It's important for reproduction. The cells in the reproductive organs require high doses or high amounts of vitamin A to properly function. Vitamin D is a prohormone. In essence, vitamin D helps regulate insulin. It helps regulate inflammation. It helps regulate immune function. So very, very important nutrients. Vitamin E is the most, we call it the great fat protector. It protects your fatty membranes in your body. So it's a very, very potent antioxidant. And vitamin K plays a role in getting minerals into your tissue. It helps calcium and magnesium and other minerals get into your bone and other tissues. But it also serves as a clotting agent. So it's vitamin K is important for how your blood is capable of clotting so that you don't bleed to death. So these fat-soluble vitamins are super critical and super important for your overall health. And part of the way that you absorb them is through the function of the liver. So again, if you're damaging your liver through your food, you're also damaging your nutritional capacity to absorb the fat-soluble nutrients from the food that you're eating. So very, very important that you understand that, because, understanding means that you're going to be more compliant next time Thanksgiving comes around, next time a holiday comes around. You might think twice about what you're putting in that could potentially damage your liver. Lisa chiming in from Orlando. Hi, Lisa. Hello from Long Island, New York. Donna. Hi, Donna. Hello from Texas, Veronica. Charlotte, North Carolina, Sharika. All right. Darlene from Northern Indiana. So again, welcome to the show tonight. So again, the liver is not just an agent that helps us detox. It is a vital organ that can produce sugar, glucose in time of need, can release stored vitamins and minerals in times of need, helps produce bile to help bind toxins in the gut, but also to absorb and digest fats properly. So liver plays a lot of different functions. Now, many people will say that with the liver, that you'll hear the terms phase 1 and phase 2 detoxification, meaning the liver can detoxify things, and generally this comes in 2 phases. And the first phase, which is typically, maybe you've heard this and maybe you haven't. I'm going to type it in for you because it is important. And let's see here. If you've ever heard, nope, got to do my keyboard here, of this, it's called the Cytochrome P450 enzyme. This is the name of an enzyme system that is housed in your liver that helps you to detoxify. And a big part of Cytochrome P450, or sometimes abbreviated as CYP450, is that it helps to break chemical toxins down from a fat-soluble form to a non-fat-soluble form, and it gets your body ready, your liver ready for phase 2 components of detoxification. So phase 1 is basically, it's like pre-filtering the garbage, and phase 2 is like actually getting the garbage into the garbage bag so that you can carry it out to the curb. And so you want to make sure that phase 1 is working. And why do we even talk about it without being too sciencey? Phase 1 is critical because so many different drugs affect the Cytochrome P450 enzyme system. So if you're using multiple medications, one of the warnings or risks on medication labels or on bottles is, this product can affect your liver. This drug might affect your liver. It's important that your doctor check your liver enzymes every 3 to 4 months or every 6 months, depending on the medication, to make sure that the drug's not destroying your liver. And one of the reasons why is many drugs actually affect the P450 enzyme system and can damage it. So in essence, the drug itself that you're taking to try to improve your health damages your liver, which then in turn doesn't bode well for your health. I know it doesn't make a whole lot of sense, but again, I want you to think about this. So if the drug that you're taking is affecting the CYP450 enzyme system, it's important that you know that, because that generally means that your liver has to deal with the consequences of that drug. So if the dose is too high, or the dose was incorrect, or maybe there are certain genetic mutations where some people don't detoxify as well, certain drugs passing through these enzymes as others, because there are subclasses of the cytochrome enzyme system. There are different variants of this system, and some people are not good metabolizers of certain types of drugs. So one of the things that I would ask you to do, if your doctor's prescribing a drug, check with your doctor to see if the testing is available to measure you genetically to see which drugs are going to be more challenging for your body to metabolize. Because if you don't metabolize certain medications very well, but he puts you on a very, very high dose, the only way you're going to find that out is by feeling horrible or having an adverse event with that medication. So it's better to test in the front. And if the doctor isn't willing to do that, you might want to sit down with another doctor and have a different kind of conversation. But a lot of these drugs, look, we can detect whether the drug is being metabolized, which system is metabolizing that drug, and whether or not you have a genetic mutation that might affect your ability to metabolize that particular medication. So it's an important conversation to have with that doctor, because there are a number of drugs that can wreck your liver. And again, when we're talking about liver disease, and you're talking about food can destroy your liver, and medicines that are supposed to be treating the symptoms that your food created can also destroy your liver, and you don't know that, and you don't know how to address that, then you're kind of at a loss. And then you're told you have liver disease that has nothing to do with the medicine, or that doesn't have anything to do with food. And in my experience, that's generally a very, very wrong conclusion to make. So, okay, so the Cytochrome P450 enzyme system, generally phase 1 of liver detoxification. Then phase 2 is another part of liver detoxification where you're getting the toxins into a water-soluble form. So the liver is actually converting those toxins from one form into a water-soluble form so that we can pee it out, so that we can sweat it out, so that we can breathe it out, right? This is how we get rid of these things. If we make them and turn them and convert them into water-soluble, it's a lot easier to get them out of our bloodstream, to get them out of our body through kidneys and through proper filtering. So keep that in mind. There's 2 parts of liver detoxification, and they're both important. And again, if you're on certain medications that affect that phase 1, it can really put a kink in how you're capable of metabolizing not only drugs, but other things as well, other environmental toxins. We talked last couple of times ago about xenoestrogens and artificial estrogens. Well, those have to be metabolized through the liver as well. So again, if that process is being bungled up or blocked, you can run into a big problem. Matthew Gibbs is chiming in. I can always help with PGX testing, he says. Which is true. This is the type of testing that can help you to determine this. So thank you, Matthew, for chiming in. And those of you who might have questions, just give him a direct message. Misty Rushing chiming in from the Scleroderma group. Good evening, Misty. Jane is chiming in. Esther from Maine. Denise from Maine. Okay, more people coming on board. Welcome aboard, and glad to have you. So, again, liver detoxification is an important process. And why am I having this pre-conversation before we get into it? Because a lot of people just want to do a liver detox or a liver cleanse. where they just take some vitamins and pills and supplements, and all of a sudden, they feel like everything is better. You can't do that. You can do that, and a lot of people do liver detoxes. But the problem with it is, if you abuse your liver and use the liver detox as an excuse to abuse your liver, you're going to run into major issues. And I don't recommend that, because it sets bad habits and it sets bad examples to those in your life, especially if you're a parent, you've got kids, and you're damaging your liver on purpose, and then from that point, then you're just doing a detox and showing them it's okay to damage yourself as long as you come back and take some pills. That doesn't make any sense. So you want to, live as you want them to live, and teach by example, not a do as I say, not a do as I say, but not as I do kind of methodology. It doesn't work with kids. So again, liver detoxification is a critical piece. Let's think of some of the other things that the liver does that you need to know about. Liver converts your thyroid hormone. So peripherally speaking, your thyroid gland makes T4, and that T4 then travels to the liver through the bloodstream to be converted to the active form of thyroid hormone called T3. Now, that conversion is not explicit to the liver. It also happens in your muscles, but it is a big place where that happens. So the liver is a big place where you actually are capable of activating thyroid hormones. So again, if you're damaging your liver, you're damaging your thyroid, you're damaging your nutritional storage, you're damaging your mineral storage, you're damaging your ability for phase 1 and phase 2 detoxification, you're damaging your ability to absorb fat-soluble vitamins through bile production. So those are all pretty important things. I think we could all shake our heads and agree that those are important functions that the liver has. Let's now talk about some of the other common things that we know can damage the liver. So aside from medications, one of the biggest things I see damaging livers is gluten. Now, for the sake of not sounding like a broken record, gluten and grains are, notorious for creating a liver problem. And there's actually a number of research studies, and I can post some of these up for you. Let me see if I can pull those links for you, on autoimmune liver disease and gluten exposure. So many people have, and I'm going to post these in the comments for you to check out here. Here we go. There's a study I just published, or just put up for you if you wanted to read more about autoimmune hepatitis. So many of you have been told potentially that you have an autoimmune form of liver disease, also known as autoimmune hepatitis, or AIH, as it sometimes is abbreviated. And autoimmune hepatitis, gluten can definitely cause it. I've seen cases of autoimmune hepatitis go into complete remission where the liver enzymes completely normalized after getting gluten out of the diet altogether. And not just classic gluten. Again, many of you listening might not have read No Grain, No Pain. If you haven't, again, I say it every week, read No Grain, No Pain. It might save your life. The information is deeper than a gluten-free diet. But corn, the gluten found in corn, I've seen at least in my own clinical experience, is notorious for damaging the liver. And I oftentimes will see patients with an autoimmune hepatitis come in for nutritional support. And what ends up happening is they're already on a gluten-free diet. They're already on a wheat, a barley, a rye-free diet, but their liver enzymes are still sky high. Their skin is jaundiced. Their eyes are jaundiced. They're not detoxifying well. They're not capable of proper metabolic function. And we find that once we change their diet, once we start alleviating some of the other grain, that they make a big change or a big improvement in their liver enzyme markers, and they start actually processing again in their skin. The yellowness goes out. That jaundice, the yellowing of the skin, happens to be a buildup of a chemical from red blood cell metabolism. That chemical is called bilirubin. And you might have heard of this before, because sometimes infants are born and their livers are not mature enough yet to process. And so those babies get put under an ultraviolet light, because UV light helps to break down bilirubin in the skin, so it can kind of take a burden off the liver while that baby's maturing. Well, what happens in adults with liver damage is their skin can turn yellow as well. The whites of their eyes can turn yellow. It's not uncommon to see this, especially in autoimmune hepatitis. again, where food or potentially where an infection can be one of the triggers or known causes. So it's not that gluten is the only trigger, but it is a major, major trigger for liver disease. What sometimes is referred to, if it's not an autoimmune liver disease, is sometimes referred to, I see it mistakenly referred to as non-alcoholic fatty liver disease, meaning the person's not an alcoholic, they don't drink, but they have liver damage and the doctor doesn't know why, so they call it NAFL, non-alcoholic fatty liver. And that oftentimes I've seen been associated with gluten exposure as well. So gluten can cause autoimmune hepatitis, but it can also cause what's again referred to as non-alcoholic fatty liver disease as well. And I've seen direct cases, again, go into complete remission with diet change, which to me is nothing short of miraculous when you consider the alternative, which is there's not a lot of medication to treat autoimmune hepatitis. There's not a lot of medical intervention that's successful at eradicating autoimmune hepatitis or at eradicating liver disease in general. So if we can identify a food as a trigger, again, particularly gluten, then that can go a long way to helping a lot of people out. So keep that in mind. Now, other foods can trigger it as well. I've seen other foods and other food allergens be a big trigger for what, again, non-alcoholic fatty liver disease or liver damage. Generally speaking, a doctor will run an ultrasound to identify a fatty liver. If they find it, sometimes if they suspect it's a big problem, they might run and do a liver biopsy to make sure there's no cancer. But generally, that's the first kind of screening test. So if you are considering this, just understand that when you do go to your doctor, that's generally what they're going to run first is an ultrasound of the liver. Sometimes they'll do additional scanning or additional testing, but that ultrasound can help to identify a non-alcoholic fatty liver. And I keep saying non-alcoholic fatty liver because, again, the primary cause of liver disease in this country is alcoholism. So going back to what else damages the liver, and that's alcohol. And again, part of why I wanted to talk about this evening is because, again, during the holidays, many of you will celebrate with too much alcohol. And let's change that to here we go, alcohol and liver disease. So again, many of you drink a lot during the holidays. It's, and when I say a lot, let's define kind of the parameters of a lot versus not a lot. So some people will say, yeah, I just have one glass of wine, but they're having it every night, right? That's a lot. That's not a little. I know maybe you've heard from the cardiologists or from the wine companies that red wine taken every night is somehow healthy. It's not healthy to put a toxin in your body, and alcohol is a toxin. It's not healthy to do that on a nightly basis. There's a lot of propaganda out there, and there's some research that's a large part of it is it's funded by the industry that wants you to buy wine. So don't necessarily buy into that hype. And again, that's not that you couldn't enjoy a glass of wine. That's not that you couldn't enjoy a drink occasionally. It just simply means that if you're doing it on a daily basis, it is not an occasional drink. You're not a light drinker. You have to understand that one drink a week would be considered mild use. But if we're really talking about how do we mitigate whether or not we're drinking, look, in my clinic, when I see people either heal or not heal, if alcohol is part of the equation, it isn't happening. They're not healing, especially if they're drinking even once a week. And even if it's 1 to 2 drinks per week, it still can stifle the healing process. So I want you to keep that in mind. There may be many of you out there that have struggled. Maybe you've gone grain-free or gluten-free, but you're still struggling, but you're drinking on the weekends. Look, this is something that you've got to look at getting rid of for a time. Remember, alcohol suppresses healing. Alcohol causes vitamin and mineral deficiencies. Alcohol can damage the liver. And so in damaging the liver, it can do all those things that I just talked about, which is the liver stores nutrients. The liver helps to absorb nutrients. So not only does alcohol cause deficiency, but it can damage the liver and hinder the liver's ability to deliver these nutrients when there's a greater need. So it's kind of a double hit. So keep that in mind. Again, I'm not saying you can't enjoy the occasional glass of wine, but let's define occasional. Occasional is once a month, not once a week, not once a night. So if you want a realistic definition of occasional, you really need to start thinking about it as, enjoying it once a month, not on a consistent basis. Many of you are chiming in on this. Alcohol is not for me. Absolutely true. Nope, no alcohol. Yes, absolutely. Look, the liver, if you don't support the liver when you're trying to recover from chronic degenerative disease, and you hinder the liver through excessive alcohol, and again, excessive, I just defined it what excessive is. If you're drinking a glass a night, that's excessive. If you're drinking several glasses on the weekend, that's excessive. Once a month is what I would recommend. And if you're really sick, I recommend keeping it out until you recover. And then if you decide you want to come in and have, an occasional glass, then you can choose to do that. But the other thing you have to remember about most alcohols that are produced, especially in the U.S., is a lot of the products that are being used, they take the grain that's being used produces a lot of these alcohols. So like if you're drinking whiskey, or if you're drinking bourbon, or if you're drinking a number of other hard alcohols that are grain derived, even some of your vodkas are grain derived. Look, those not only are getting potential for grain, and they'll tell you they're gluten free, and technically they are because there's no protein in them, but what about all that pesticide that grain was grown with? What about all that mycotoxin? So alcohol is one of the biggest, most direct sources of mycotoxin and potential pesticide exposure because of the way those grains are grown and produced in this country. So you've got to keep those things in mind as well. It's one of the reasons why a lot of people just don't do very, very well at all with any form of alcohol. I mean, one of the reasons, not the only, but one of the reasons. So again, you got to keep those things in mind. If you're drinking, especially over the holidays, a lot of people, they end up going backward in their health during the holiday season. And so what rounds out the end of the holiday season, and in this sense, Thanksgiving, but we're coming into Christmas. And then just beyond that is New Year's resolutions, right? And a lot of people will make their New Year's resolution, meaning I just gave myself 2 months permission to damage my body because I know I'm going to make a New Year's resolution and change my ways. That's kind of the mindset of how a lot of people approach this. Don't do it that way. Don't tell yourself I'm going to fix it in my New Year's resolution, because when you say that to yourself, you're giving yourself direct permission to do as much damage before the New Year as possible. So keep it real through the holidays. Your body will thank you for it. Your liver will thank you for it. So alcohol, major contributor to persistent liver damage. A couple of other things that are important to understand. There's a few nutrients I want to mention that play a role in liver health. And one of them is very, very little discussed, choline. Choline is a special nutrient. It's like a B vitamin, and it helps the liver metabolize fat. It helps the liver deal with fat. So what can happen is that, and I like to test in my patients, I like to test directly for choline deficiency, is that a choline deficiency can cause fatty liver disease. In essence, if you don't have adequate choline, you don't have the capacity to properly metabolize the fat, so your liver starts taking it on and storing it. So choline deficiency is one of those known nutritional deficits that can cause fatty liver infiltration. Another one is inositol. Inositol can do it as well. Inositol also similar to choline in that it's like a B vitamin, although technically it's not classified as a B vitamin. So if you've not seen that term before, inositol is in a number of different products. It's in a number of different products. So again, choline deficiency, inositol deficiency can impact the liver. Another one is vitamin B12. Vitamin B12 deficiency can also impact the liver. Now, this one's a big one because a lot of people with gluten sensitivity are vitamin B12 deficient because gluten damages the area of the stomach that absorbs vitamin B12 from the diet, or helps to absorb vitamin B12 from the diet. So it's kind of a catch-22. The gluten itself can create the liver problem, but then the gluten can damage the stomach, which leads to B12 deficiency that can also cause the liver problem. Again, this is why if you're approaching a liver issue, you really want to have your nutritional status looked into and checked on, because there are so many different nutrients that can impact the function of the liver's capacity to detoxify, the liver's capacity to do its job. Another nutrient that's very important for liver function is an amino acid called cysteine. And actually, I'm going to put in 3 here: cysteine, glutamine, and methionine. And the reason why these three are important is they combine together to form the tripeptide glutathione. Now, many of you have heard of glutathione before. Glutathione. It's oftentimes referred to as the master detoxifier in the body. It's what the liver uses to detoxify a lot of different things. So glutathione is composed of cysteine, glutamine, and methionine. Those three amino acids come together to help make glutathione. Now, the other thing you need to make glutathione that can also affect the liver is selenium and vitamin B2. So again, all of those nutrients are very, very important for healthy liver function. If you're doing things to offset the balance in those nutrients, you can, in effect, affect your ability to do proper detoxification. So again, all of these are important. Why are we talking about it? Because again, I know that many of you might be drinking a lot of alcohol and over the holiday season, and this is where the potentiation for the damage can begin. So I'm going to take a little bit of time here. We're at that time to grab some questions. All right. Some people are asking, looks like the question asking about enemas. I think there are different ways to do enemas. There's coffee enemas, which can be very, very helpful at helping the liver to secrete extra bile to bind to toxins in the intestine and to push out push out toxins from the intestine. Sorry, I was saying Texans and intestines at the same time. It came out wrong. So a coffee enema can be done, although, look, you shouldn't have to do coffee enemas to have a healthy liver. I mean, the reality is that it shouldn't be something that you're having to do on a regular basis to be healthy. Other question coming in. Valerie's asking, fermented grains are okay, right? No, not if you're gluten sensitive. If you are gluten sensitive, fermented grains aren't okay. No grain is okay if you're truly gluten sensitive. So Valerie, how do you know if you're gluten sensitive or not? You get genetically tested. Genetic testing for gluten sensitivity is the main way to help identify whether or not you should be avoiding those types of fermented grains, because there's a lot of people out there saying, look, fermented grains are healthy, fermented grains are safe. You can make that argument, but not for somebody with a gluten sensitivity issue. So if somebody is gluten sensitive, it doesn't matter whether the grain is fermented or whether the grain is not fermented. If you have a gluten sensitivity issue and you're eating grain, you're going to have a problem. And that's, again, fermentation doesn't get rid of gluten. So I'm going to put a link up here for you on genetic testing, just so you'll have it as a resource and you can go read more about it. Let's see here. There you go. Just posted the link for you, give you a little bit more clarity. The other thing, I'd encourage you to do, go read No Grain, No Pain. There's so much information in there. There's the old saying, you don't know what you don't know. Get out there and read it, because if you could be doing accidental damage to yourself by not having some of the information. Again, you don't know what you don't know. Let's see, lots of questions on this. Alina is chiming in, and I want to just say thank you for chiming in. But she's absolutely right. Gallbladder disease can be caused by celiac disease, which, in essence, it's not the celiac disease that's causing the gallbladder disease, though. It's the gluten. So if we're being very clear, gluten can cause celiac disease, but it's also associated or linked to gallbladder disease as well. And sometimes that's the only symptom that a person can have. So it's absolutely true. Thank you, Alina, for tuning in tonight. Let's see here. And if you have questions, we got a few more minutes. I want to make sure I get as many answered as possible. Make sure you're typing those in for me. Oh, JJ, sorry to hear of your father's passing of liver disease. That's a tragedy. And you're absolutely right, JJ. Diet plays a huge role in that, even above and beyond alcohol. Although a lot of people alcohol binge on the weekends, and that plays a huge role in it as well. I love this comment, Teresa. Yes, been alcohol free for 1 year. What a difference! I no longer have any issues. I love hearing that kind of stuff. Misty, I stopped drinking alcohol when I was diagnosed with scleroderma. Another comment, Janine, cirrhosis, 17 years. I was given a year to live in 2001. Alcohol so toxic, gluten, chemicals, glyphosate. Yeah, all the above. Okay. Kathy from Ireland is saying hello. Hi, Kathy. Question coming in, how can I detox? Okay, I knew that question would come in eventually. So there are a couple different ways. I mean, really the best way to detox is to not put poison in, right? And that, I know that doesn't help a person who's looking to actually purge poison out. So let's think about this in two ways. To do a detox, number one, you don't want to do a detox, which is just really a retox. So the first step in doing a detox, a healthy detox, is to stop the poison. Quit putting in the poison. Don't do a detox and say, I'm gonna start putting in poison after the detox again, because then you just get stuck in the vicious cycle. So step one, quit adding poison. Step two, there are a number of things that can be done that are very, very effective for the liver, that help the liver. And one of the best nutrients to aid in liver function is actually called milk thistle. Now, many of you have heard of milk thistle before. It's a very, very common supplement. There's a lot of research on milk thistle and liver health, but it's one of the most effective ways to support liver function. And so one of the things that I would recommend as a supplement to make sure that you are using that, especially if you've got any kind of elevation in liver enzymes on your blood work. So if your blood work shows that you have an elevation in liver enzymes and you're looking for a way to support your liver health and your liver function, then milk thistle can be very, very effective. Actually have something called Ultra Liver Detox, which contains a lot of the nutrients I talked about tonight. It's got milk thistle, it's got cysteine, it's got selenium, it's got alpha lipoic acid. There are, again, a number of different things that can help the liver. Choline can help the liver. Inositol can help the liver. So the best way to detox is not to just do a generic across the board, hey, let's just detox. Really, the best way to do a detox is to determine what it is you need to detox from, because there may be certain things inside of you, and we may want to support phase 1 liver detoxification. We may want to support phase 2. Depends on what's in you. Depends on what you've been putting in you. So the first step, aside from the discontinuance of adding poison or continuing to put poison in, is to identify what poisons are for you as a unique person. So get with your functional medicine doctor, make sure they're doing the right types of tests to help you identify environmental poisons aside from the obvious. So, I mean, when I say aside from the obvious, pesticides are a poison. We all know that. You should be buying organic and you should be looking for that. But some of you are allergic to broccoli. Some of you are allergic to cauliflower. Some of you are allergic to beef. There are variances from one person to the next. One man's food is another man's poison. So having a doctor that you can work with that can test for those things so that you can only put the good in and at least stop the damage from happening. Additionally, having that doctor measure your nutritional status, because you can test all those nutrients that I just talked about earlier. Those can all be tested for. It doesn't really serve you to add more selenium if you're not selenium deficient. It doesn't really serve you to add more cysteine if you're not cysteine deficient to support glutathione. But if you are deficient, it very, very much serves you in a very direct way. In essence, it could be the difference between improvement and a complete lack of improvement. So diving deep into what is it that's unique about you is the best thing that you can do to support and do a proper detox. If you're just doing a generic detox, my favorite way to do a generic detox is the use of vitamin C. And vitamin C in high doses is very, very safe. The protocol that I like to use was actually originally put out there by some brilliant minds like Linus Pauling, but it's basically 6 grams of vitamin C mixed in 3 ounces of water every 15 minutes until you have a bowel flush. And it can be a very, very effective detoxification. Many people, after doing this, feel tired and they need to sleep, but after they wake up, they feel energized and they feel refreshed. So that's one thing that can be done, is to do a vitamin C flush. Aside from that, if you're just, again, generic, is to use the use of milk thistle is probably one of the most effective ways to support healthy liver function. Okay. Virginia says, I have a fatty liver. What can you tell me about that I am not a drinker? I don't understand your question. What can I tell you about that you're not a drinker, meaning that you're not a drinker, so why do you have a fatty liver? If you have a fatty liver and you're not a drinker, then you have a food problem, at least in my experience. I've seen cases where people didn't have a food problem as much as they had a chemical exposure problem. Like one time I had a farmer who was exposed to lots of the pesticides because he was out there helping with the application, and he developed a liver problem as a result of the exposure to the pesticide. Now, I've also had a number of patients who had been prescribed by their other docs a bunch of different medications that affected the liver, and their doc didn't tell them about it, or they put them on multiple drugs that affected the liver, and so they ended up having liver damage as a result of the medication. So again, that's another potential reason why it can happen if you're not a drinker, if you're not drinking alcohol. Let's see here, Debbie. Did I miss thyroid-related liver issues? We'll replay. So yeah, yes and no, Debbie. If your liver's broken and it's not converting T4 to T3, you're not going to be having good conversion of your active thyroid hormone, and that can cause hypothyroidism. It's again, so understanding that the liver plays a role in activating your thyroid hormone is very, very important. That's why we want to take care of our livers. So we talked about that a little bit. But I talked in much, much greater detail a few months ago on the thyroid in another episode of Pig Dr. Osborne's Brain. So you can go back into our archive. And if you subscribe to our newsletter, if you subscribe to us, you have access to all of that information there online. We keep it stored online. Let's see here. Angela, how do you feel about low carb, high fat, moderate protein diets in treating fatty liver? Look, I don't like any generic diet to treat any condition, because you don't know whether or not it's going to work unless you know it's going to work for you. So I don't, again, I mean, people are going to experiment with their diets, and not that that's a bad thing necessarily, but if you're on a high fat diet, that might be the wrong move. A low carb, high fat might be the wrong move for you if you have a fatty liver, and it might be the right move. It could go either way. So it's not how I feel about it as much as it is what the person has a fatty liver for in the first place. In essence, what's creating that? If what's creating that is carbohydrate toxicity, then a low carb, higher fat, moderate protein diet might be very, very effective. But if that's not the cause, or if that's not the trigger, then it could potentially create some problems. Good question. What's the best testing for assessing the health of the liver? There's several different tests. There's no best test per se. There are best practices. And so a couple of different things that can be done in the blood that are simple, that are just general screening that most doctors will do when they run what's called a chemistry panel or a chem panel. So there's an enzyme called alanine aminotransferase. It's sometimes abbreviated as ALT. There's another one, AST. Let me put these up on the board for you. These are just tests that can be very easily run. So these three are general tests: ALT, AST, and bilirubin. You can add one more to that list. It's called alkaline phosphatase, or ALP. These are all great screening tests to try to see if there's damage happening to the liver. What these are, generally speaking, ALT and AST and ALP are enzymes that when liver cells are damaged, those enzymes are released in higher quantities. So it's again, if we're taking on big damage to the liver, these are tests that are very effective. Now, one of the most accurate ways to pick up on early liver damage, in essence, some of these tests are they're not early detectors of liver damage. Oftentimes the liver damage has to be so great before they're picked up on. But looking at the nail beds, I did a video on this maybe it was about 6 months ago on the fingernails, what the fingernails can tell you about health. And one of the symptoms in the fingernail is something called a splinter hemorrhage, and it looks just like a little dark line embedded in the fingernail itself. Those are called splinter hemorrhages, and those are oftentimes a sign of liver damage, even if liver damage tests or liver function tests are normal. Now, some doctors will also do an ultrasound of the liver, which I mentioned earlier, and that's a great way to look at liver health in a less toxic way, because the CT scans can do a lot of radiation damage to a person. So just depending on their history of scans and how many they've had, and depending on the nature of or the acute nature of the situation, it might not be a bad idea, but an ultrasound is generally a pretty good way to help assess whether or not the liver's taking on fat. Let's see here. Pam, could a pain in the upper mid-abdomen be liver gallbladder? It could be. It absolutely could be. That doesn't mean that it is. Again, it's one of those things. Your body is very, very unique, and everybody has a wiring system. You know, you have your brain, then you have your spinal cord, and then you have all the nerves that branch off the spinal cord and travel to the different organs and different tissues. And you can look. The reality is it just like if somebody is having or if they think they're having a heart attack, they typically have that left arm pain. Well, some people are not having a heart attack; they're having left arm pain, but the doctor wants to rule out a heart attack. So there are pain patterns, and there are referred pain, and there's what's called somatovisceral pain and viscerosomatic pain, meaning an organ can be damaged and can create physical pain, but also physical pain can be there, and that can create referral to an organ. So it can kind of go both ways, just depending. So to answer your question, yes, it could be liver or gallbladder, but it might be something completely different. And again, the best thing to do is have a qualified doctor have a look at that. Let's see here. Fintan, gluten sensitive but tolerating oats well in a regimen with chicken, which is healing psoriasis, eczema. So I don't recommend that, Fintan. Tolerating oats, if you're gluten sensitive and you're eating oats and you're potentially, one, there's a huge risk for gliadin cross-contamination of oats. But two, oats have a form of gluten called avenin that has been shown to do damage to people with gluten sensitivity. So I just don't recommend that as a course of action. Again, if you read No Grain, No Pain, the details of the science are all in there, and you can take that what you will. Okay. So Shannon's asking, what is better, NAC or milk thistle, or is anything else better? Milk thistle, in my experience, hands down, number one. If I could only make one choice, it would be silymarin, which is the active ingredient found in milk thistle that has liver preserving properties. So that would be what I would choose if I only had one choice. It's not that even necessarily one is better than the other. It's just, look, milk thistle helps liver cells. NAC can, but again, if you're not NAC deficient, it might not be the best thing to do. Kim, thank you for doing what you do. You're welcome, Kim. Thanks for acknowledging that. I appreciate you too. Let's see here. Does the liver regenerate? How often? Yeah, liver's a fast healer. That's the great news. The liver can regenerate, and it's actually one of the quickest healers in the body. So, again, that's why I was talking about earlier, get rid of the poison first, take the poison away. And the liver, a lot of times, you don't need to do heavy, long stem detoxes. Your liver will heal, provided you have the right nutrients on board to get that going. Laura's asking, can I use milk thistle if I'm on Lipitor for high cholesterol? Yeah, there's no contraindication between using those two together, but it's always a good idea. Laura, I mean, okay, everybody, medical disclaimer. I'm not on the show to teach you how to treat your condition or my information is not designed to supersede the relationship that you have with a qualified doctor. I'm just trying to give you tips and clues. There is no interaction between milk thistle and Lipitor, meaning they're not going to interfere with each other's mechanisms of action, but it's always still best to have that conversation with your prescribing doctor. My bigger question, Laura, would be, why would anybody put you on Lipitor? It's been around for 30 plus years, and it has not reduced mortality rates or has not reduced death rates from heart attacks and heart disease, especially not in women. So why would he have you on a drug that has that type of empirical data to not really support its use? That would be the bigger question I would have with him. Let's see here. Natalie Bankhead. Hello. Hey, Natalie. Good to see you. I hope you guys had a wonderful Thanksgiving. Let's see. My Chinese doctor has me doing a liver cleanse for 15 days with whole lemon, 16 ounces of water, olive oil, and honey. Yeah, that's actually a great gallbladder cleanse. It'll push bile out of your gallbladder, and it can help you cleanse. It's not a bad one to do, and it's very inexpensive to do it that way. Those ingredients. But if you're going to do it, those of you reading this, look, work with a doc to do it, because there are side effects that can happen with this type of liver flush. Denise is asking what type of vitamin C. I'll put that up for you, Denise. We're talking about a pure flush. You want Detox C powder. And let's see if I can pull that link for you. And here we go. I'm going to post that up for you so you'll know the one I recommend. Let's see here. Here you go, Denise. Should be showing up in your feed. Okay. We're running out of time here. Just take time for a couple more and we'll have to wrap it up. Let's see here. Lorraine, I have end-stage autoimmune cirrhosis with very high bilirubin, but very healthy considering. Are infrared saunas safe to use at this stage? Frequency, I don't seem to sweat anymore and seem to have moderate muscle wasting with advanced cirrhosis. Look, I'm sorry, I don't mean to dodge your question, Lorraine, but this is too complex of an issue. I mean, Facebook will not merit justice to this question. I think you've got to work with I think honestly, the best suggestion I can give you is get in with a qualified functional medicine doctor as quickly as you possibly can. And whatever you do, make sure it's supported objectively and make sure that you're being monitored, because, that's a serious situation. You don't want to just do something. You don't want to just do something to do it. Let's see here. So this is an interesting one. I'll just chime in on it. Angela saying that her 23-year-old son is very thin, non-drinker, and diagnosed with Gilbert's disease. Look, that's one of those I've actually seen people do really, really well on a gluten, grain-free diet with that condition and seeing bilirubin correct and seeing jaundice go away. So you might just want to share that with your son, but maybe get him a copy of No Grain, No Pain for Christmas and have him do the 30-day protocol in the book and see if he notices a change or improvement. I personally have seen it in my clinic, but I don't want to make a blanket statement either. But it would be certainly worth attempting and doing. Let's see here. Nina, you're too kind. Thank you so much for your compliments.